Hello, this is Arlene Morris, and I want to talk with you about some recent national recommendations for improving long-term care. This is for FACES in Montgomery, Alabama, April 19th, 2022. Again, my name is Arlene Morris, and I have my email here on this slide. If you'd like to talk with me or contact me, please feel free to do so. Patient priorities care. This is a term that has been coined by the Hartford Foundation, the John A. Hartford Foundation, and I'll read what this describes. Patient priorities care aligns care among all the clinicians with what matters most to their patients. It recognizes that patients are the experts in what they want to achieve from their health care, and then the clinicians are the experts in how to get them there. The John A. Hartford Foundation's Age-Friendly Health Systems discusses this more, and you can look for that online. It's free. The 4 M's is the term of the framework used to enhance the quality of care, and that refers to assessing what matters, what medications they're taking, what is their mentation, and what is their mobility status. With each interaction, that's a framework that you're thinking to consider not only what are your assessments, but what is it that is going on with the patient that matters most to them. The National Academies of Sciences, Engineering, and Medicine helped do a study, a blueprint for transforming nursing homes that just came out a few weeks ago. It was co-sponsored by the John A. Hartford Foundation, the Commonwealth Fund, the Sephardic Foundation on Aging, the Fan Fox and Leslie R. Samuels Foundation, and this study presents 7 goals that we will talk about for the nursing home workforce, for quality, equity, and respecting what matters most to nursing home residents and their families. So it's really a person, family-centered approach to care. A little history before we go into the 7 points in this. In 1986, the Institute of Medicine report, Improving the Quality of Care in Nursing Home, formed a foundation. This Institute of Medicine report identified many of the complex challenges in nursing home care. Recently, the COVID-19 virus has just had a devastating effect on the nursing home residents and their staff. And then this National Academies for the Sciences, Engineering, and Medicine agencies report concluded that the way in which the United States finances, delivers, and regulates care in nursing home settings is currently ineffective, inefficient, fragmented, and unsustainable. So they saw that if the status quo of how the funding and the focus of current long-term care continued, it's just not sustainable. And we have seen that with the COVID virus, that it's so difficult to get staffing. So that's one of the issues. So let's go through these 7 broad goals that were identified, and they were just published a week ago. Goal 1 is to deliver comprehensive, person-centered, equitable care that ensures the health quality of life, safety, and safety of nursing home residents. And it promotes nursing home resident autonomy and manages for potential risks. So additions to this that are within this report include resident safety in the event of public health emergency or natural disaster. We've all seen in the news where, especially in our area of the country, when tornadoes and weather events and other emergencies occur, the devastating effect that has on long-term care residents. So to have a plan in effect, and suggests that nursing homes should be redesigned in a more home-like setting, less like a hospital format with the long halls, but perhaps in clusters or different settings with a more community feel. And that's a recommendation for going forward. The Agency for Healthcare Research and Quality, the Centers for Medicare and Medicaid Innovation, the Centers for Disease Control and Prevention, the National Institutes of Health, academic and private organizations are all encouraged to prioritize research for what are the ways to achieve the most effective care delivery models across the continuum of care, including long-term care. Goal 2 is to ensure a well-prepared, empowered, and appropriately compensated workforce. Now, we all are familiar with the crisis that occurred in staffing of long-term care and acute care settings during COVID, with the nurses that just were burned out and that left the field of nursing. So this is a very important goal. And to build on that, the Centers for Medicare and Medicaid suggest enhancing minimum staffing requirements based on research to test specific minimum and optimal staffing standards. We've all worked where we were short-staffed, and we just know that the quality of care cannot be achieved if you don't have enough people to do the work. Another innovative recommendation is for nursing homes to help cover the certified nursing assistants education time. Currently, to be qualified, you have 75 required hours, and they recommend increasing that to 120 hours with competency-based training requirements, much similar to in nursing programs. And then that would provide a basis to allow pathways from the certified nursing assistant to progress with more time, more education, but seamlessly progress, not repeat what they've learned, but seamlessly progress to an LPN program, potentially with shorter hours required because you've already completed the 120 hours for the CNA certification. And then from the LPN, we know that there are thoughts about how can we add a couple of extra semesters and have an LPN to RSN role. And so we're trying to understand these recommendations for how to make it smarter and intentional to help increase our workforce. Goal 3 is to increase the transparency and accountability of the finances, operations, and ownership of facilities across state ownerships. We know that there are large companies and corporations that own and manage healthcare settings across all levels of healthcare. And so this is just to increase the awareness. The Department of Health and Human Services would collect the data and make it available to constituents. This is recommended to be online. So for example, if I'm in Alabama and I have a family member in Tennessee and I want to find out what the rating of a facility is before my family member is admitted, I would be able to look online, and even though the corporate office is in Alabama, perhaps, I would be able to see what are the finances and what kind of operation reports have been done for the facility in another state, which makes it transparent for the consumer. Goal 4, and this is highly important, is to create a more rational and robust financing system We know healthcare is getting ever more expensive, and the recommendations from the researchers in this group were to move toward a federal long-term care benefit, much like an insurance benefit, and potentially extend bundled payments to all conditions. You know that in hospital settings there are bundled payments received for certain categories of illnesses, and so the CMS and the Health and Human Services will conduct demonstration projects to really research what would be the benefit of alternative payment models, separate from the bundled payment initiatives for post-acute care, to cover more needs. This would be just to enhance the coverage for more people and for more needs, and assure a steady, stable flow of income to not have long-term care facilities shut down due to lack of funding. Goal 5 is to design a more effective and responsive system of quality assurance. The Centers for Medicare and Medicaid ensure that state agencies have adequate capacity, structure, and resources, and that would make the national levels be more equitable, and promote funding for long-term care ombudsman programs. This is a program in which state funds are used for district-level ombudsman in every state to go do interviews with residents and staff in long-term care and assisted living facilities to see what are some of their needs, what's not being met, and how can this be achieved. It's a collegial response. Also, the ombudsman are responsible for living at home options, and when someone has improved, if they've had a stroke and they have rehabilitated, to have options for living at home that they can help facilitate with some assistance, some cost assistance. The third goal in this category is to eliminate certificate of need requirements. And rather than having the certificate of need, look at different innovative care models. Through history, we've had different ways of caring for people that were sick or in need of assistance. And so what are some of these that could work, that could be cost effective, but have a greater outcome and measurable? This goal includes always doing research to find out what is most beneficial for the cost. Goal 6 is to expand and enhance quality measurement and continuous quality improvement, CQI. The Centers for Medicare and Medicaid should add a consumer assessment of healthcare providers and systems, the CAPS measures, to the Care Compare website. Again, this would ease the ability of someone in one state to look and see what's the rating in different categories in another state, and enhance the publicly reported quality measures in Care Compare to have more things that we can really look and see what is happening. How can we compare as a consumer? How can I compare the quality and the ways that one facility offers services that may be more beneficial to my loved one or to me than another facility? Goal 7 is to adopt health information technology in all nursing homes. We love computers. We love all the information they can give us, but sometimes this is a difficult goal to achieve. The Office of the National Coordinator and the Centers for Medicare and Medicaid should identify a pathway to provide financial incentives to nursing homes for adopting electronic health records. It can be costly, so this is to help provide funding for that, and also the education that it will take to get all the people on board. And then then building on that, after we have the electronic health records, to develop health information technology adoption and interoperability across settings of care, from primary care to acute care to long-term care, and see what tracks, what measures we can identify that are effective across all the settings of care or across many long-term care facilities, and to use these health information technology data points to improve nursing home resident outcomes. We know the population is aging. We know this is a situation that is going to continue, and so how can we use the data that we can collect to improve the outcomes? And this is for us. This is for our current families, but this is for our generation too. So this is an important goal. It's not going to be achieved overnight. It's going to take a lot of funding and a lot of training, and it will be painful initially, but the goal is for the outcomes to improve the quality of the care. And that's what we're here for. The references include the John A. Hartford Foundation, and this is their website. You can get further data from their website, and also the National Academies for Science, Engineering, and Medicine Committee on the Quality of Care in Nursing Homes, the National Imperative to Improve Nursing Home Quality, honoring our commitment to residents, families, and staff. This is published by the National Academies Press, and you can see how you can obtain this report at the National Academies website, www.nationalacademies.org. Again, this report just came out last week, so it's new, and we will be informed as we go forward some of the recommended changes and the ways that funding is available for this. But the goal, as always, is to improve the care for people in the current system, acute care to long-term and residential care, to also include the future generation and how it's going to impact us. So we are very committed to improving the quality of the care. I hope that you will give consideration to these thoughts, that these goals will be helpful for you, and you'll look at these websites to see other recommendations. The John A. Hartford Foundation is extremely helpful for issues related to long-term care. Dr. Terry Fulmer has been lauded for her untiring efforts to really develop some research on which we can further make improvements. I thank you for your time and for your interest, and I wish you the very best. Thank you.
Patient priorities care aligns care among all the clinicians with what matters most to their patients. It recognizes that patients are the experts in what they want to achieve from their health care, and the clinicians are the experts in how to get them there. This is from the John A. Hartford Foundation's Age-Friendly Health Systems publication. The 4 M's framework enhances quality care by the providers asking what matters to the patient, what medications the person is receiving, assessing their mentation, their ability to interact and think and respond, and their mobility. The National Academies of Sciences, Engineering, and Medicine conducted a consensus study that was co-sponsored by the John Hartford Foundation, the Commonwealth Fund, the Shepardic Foundation on Aging, and the Fan, Fox, and Leslie Sammons Foundation. And this study was just published last week, April 6, 2022, and is a blueprint for transforming nursing homes. This study presents 7 goals for nursing home workforce quality, equity, and respecting what matters most to nursing home residents and their families. The Institute of Medicine report for improving quality of care in nursing homes in 1986 laid a foundation for enhancing quality of care and long-term care. And it identified that there are complex challenges inherent in nursing home care. So recently, we all have lived through COVID-19, and we know that it has had a devastating impact on nursing home residents and staff. So the National Academies of Science, Engineering, and Medicine agencies concluded the way in which the United States finances, delivers, and regulates care in nursing home settings is ineffective, inefficient, fragmented, and they believe this is unsustainable. This report identified 7 broad goals, and that was just published last week. Goal 1 is to deliver comprehensive, person-centered, equitable care that ensures the health, quality of life, and safety of nursing home residents. And it promotes the resident autonomy, and it manages for potential risks. This includes resident safety in the event of public health emergencies or national disasters. We've seen some of that in Alabama, where tornadoes have hit long-term care facilities. This goal also suggests that nursing homes should be redesigned in more home-like settings, possibly in neighborhoods. The Agency for Healthcare Research Quality, AHRQ, the Centers for Medicare and Medicaid Innovation, the Centers for Disease Control and Prevention, the National Institutes of Health, academic and private organizations should all coordinate to prioritize research to investigate what are the most effective care delivery models for long-term care. And based on that research, hopefully in the next 5 to 10 years, strategic changes can be made. Goal 2 out of 7 is to ensure a well-prepared, empowered, and appropriately compensated workforce. One way they suggest to enhance the compensation is for Centers for Medicare and Medicaid to suggest enhanced minimum staffing requirements based on research to test both minimum and optimal staffing standards, also across shifts. And within Goal 2 is to recommend that nursing homes cover certified nursing assistants, CNAs, education time. Currently, they have 72 hours that's required to be a CNA, and they recommend increasing that to 120 hours with competency-based training requirements, and also through the reimburse them if they go through a pathway from a CNA to an LPN and then on to an RN, etc. This would maintain the person throughout their education, maintain their loyalty and their familiarity with the long-term care and with the residents. Goal 3 is to increase transparency and accountability of finances, operations, and ownership, including long-term care facilities, nursing homes, and assisted livings that have across the state ownerships. This would also include any citations, quality statistics, any reported adverse events. and that the Department of Health and Human Services should collect and make the data available online to constituents. Goal 4 is to create a more rational and robust financing system. We all want more money, and we know we're going to have an aging society, so that's going to probably involve enhanced taxing, but the goal is to move toward a federal long-term care benefit, like an insurance benefit, but it would be for all the population. Potentially extend bundled payment initiatives from the ones that already have bundled payments to all conditions. And then the Centers for Medicare and Medicaid and the Health and Human Services are encouraged to conduct demonstration projects of the use of alternative payment models, different ways of paying, and separating bundled payment initiatives for post-acute care, so that we're looking at both ways, maybe having bundled payments post-acute care and then separating the bundled payments from acute care to long-term care. Have that a separate entity and see which works the best. Goal 5 is to design a more effective and responsive system of quality assurance. The CMS, Centers for Medicare and Medicaid Services, are encouraged to ensure that the state survey agencies have adequate capacity, structure, and resources. This is, if you've worked in long-term care, when the state agencies come in to assure there's quality, often these are rushed, both by the staff and by the inspecting agencies, just because there's not enough staff and resources to necessarily do everything. But they also suggest promoting funding for long-term care ombudsman programs. These ombudsman programs pay for staff to go into long-term care, and they have a checklist of what is minimal standards, and they go around and they look for all the items on that list, and they discuss care with a variety of random residents, just to make sure that that all the care that's being needed is being provided. They also recommend eliminating certificate of need requirements, and instead of that, to encourage innovative care models, again, trying to find what works best for the best outcomes, which will require time. So these are goals, but the results will probably not be available for the next 5 to 10 years. Goal 6 is to expand and enhance quality measurement and continuous quality improvement. They recommend that the Centers for Medicare and Medicaid should add a consumer assessment of healthcare providers and systems, a CAPS measure, to the Care Compare website. This would allow the public to go to this website and see different ratings for the consumer assessment for the various agencies and facilities that if I, as a consumer, if I'm looking to compare different long-term care facilities, this website would make the different categories easily comparable across the different facilities that I'm searching. They also recommend to expand and enhance the existing publicly reported measures in Care Compare, to add different quality measures than what are already there. And you can read the specifics in the report. I've got a citation at the end. Goal 7, adopt health information technology in all nursing homes. So we're all going to computer, more and more, no more paper charting, it's all computer. The Office of the National Coordinator and the Centers for Medicare and Medicaid should identify a pathway to provide financial incentives to nursing homes for electronic health record adoption. It's a large front-end cost to establish those electronic health records, and so they want to have some subsidy for the long-term care facilities to initially get those electronic records set up, and develop a health information technology, health information technology, adoption process, and make that interoperable where the information can be shifted across settings of care seamlessly is the goal. And then use the health information technology to improve specific nursing home resident outcomes. So if I am a resident in a long-term care facility, the nursing home would be able to document the outcome from my treatment for a pressure wound to across settings of care, to my primary care provider, to the long-term care physician, and then if I'm going to be discharged and go home with home health, seamlessly to the home health agency using that electronic health record. These 7 goals will take years and financing, and they will take training. So there are other subsets in each of these goals that I did not type. You can look at those if you're interested. But the overarching goal is how can we pay for the care that will promote the personhood of each individual and promote the best outcome of their health for their health needs. I have another presentation that's talking about the roles, the different roles of people in long-term care that you may choose to listen to in addition to this one. The emphasis on that is also to make sure that the appropriate care is being provided by the appropriate level of personnel. It doesn't take the director of nursing to do all of the care, but some care that is currently done by the certified nursing assistant might have a better outcome if it was done by another person on the team, whether it be a social worker or a nurse or physical therapist. So here are my references. The John A. Hartford Foundation at www.johnahartford.org. They had the announcement for these recommendations, and then the recommendations are listed by the National Academies of Science, Engineering, and Medicine, NASM, Committee on Quality of Care in Nursing Homes, and this is in April 2022, just last week. The title of the document is The National Imperative to Improve Nursing Home Quality, Honoring Our Commitment to Residents, Families, and Staff, published by the National Academies Press, and the website is www.nationalacademies.org. I want to thank you for your time, And if you need to get in touch with me, if you have any questions or suggestions for improvement, my email is arlenehughesmorris@gmail.com. That's ARLENEHUGHES Morris MORRIS Arlene Hughes Morris is all lowercase. I want to thank you for your time. I want to thank you for your work related to the older population and populations that have compromised abilities. This is hard work. It's emotionally draining work, and we all do our best each day to improve the quality as best we can. And I appreciate all your efforts. Thank you for your time.